And hello, everybody. I'm glad all you guys could tune back in for another show as I kind of get all my last little second adjustments here. Want to make sure everything's tidied up before I get going. Man, it's a hot day in Modesto. If you live in Modesto, man, we got some heat. Got some heat out here. So, welcome everybody to another episode of Amp Life Talk Radio. I'm glad you're all with me again on Facebook. So, welcome everybody, and I got my new camera deal. I'm trying to get my head bigger in this picture, if you can't tell. So, welcome everybody. Remember, before we even start the show, hey guys, and I got like 2 minutes. I'm over my time limit. I'm like a normal talk show host now, man. Start my show late. So, share the show. That's the best thing I can say to you is share the show, because the more you share the show, the more you stand a chance of getting some of those goodies that I'm going to be giving away. I'm looking at getting some special type of coffee mugs and some tumblers with Amp Life and Amp Life Talk Radio on them. You've been seeing me post some of the pictures up on my Facebook page. So I want to encourage all of you to please share the live Facebook feed. That's what's going to get you in contention to win one of those. And tonight, if you see me sipping, I have my nice pink lemonade that I'm drinking. So it's nice and refreshing. Well, with no more stalling and messing around, hopefully everybody's tuned in. Hopefully everybody's ready for a good show. Again, I kind of get these topics from things that I see going on Facebook. So I'll get more in detail about that. You can read the brief description of why we're doing this show. But with no further ado, let me kind of get the rest of the world tuned in to us here on this show, and we'll get things started. So if you guys are broadcasting and putting stuff up, I appreciate it. Hopefully there's a new person that's going to be listening tonight. Hopefully you got the link, Zach. I think I sent you everything. I really hope you can get tuned into the show. And there's some other new people that I met today, and I told them about the show, and it's a show for new amputees. I met a couple people today who are new amputees. So hopefully you guys can get in and get to be a part of the show. Other than that, let's try and get things started. Okay. So let me get over here. I'm going to turn myself down. Hopefully you guys can hear me, because I typically do everything through my microphone, and I'm hoping that you guys can hear everything. Let's get things rolling.
You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.
And want to welcome all of you guys back to another episode of Amp Life Talk Radio again. I'm just really excited to be here. Hey, if you're in the Central Valley area, man, it is hot out here today, smoking. So I know we broadcast out pretty much all over the world, nationwide. A lot of different people listen to the podcast. So wherever you are, I hope it is not over 100 degrees because right now we're definitely pushing that in Modesto, and it is hot, people. It is hot, hot, hot. And for all of you prosthetic users out there, you know what that means. When you get the triple digits, man, things get sweaty. So welcome back, everybody, to another episode of Amp Life Talk Radio, Season 2, Episode 24, Advice for New Amputees. I came up with this show because, of course, I saw something in a chat room on social media in one of the groups that I'm in, and I actually posted this up. I reposted something that Amputee Coalition of America put up, and the feedback that I got on that really showed me that I should do a show on this, because everyone had some really good things to say, And I'm probably going to read some of your comments later on, just so you guys know that I really appreciate everybody posting their comments, because it really gives me a good sense of what you want to hear and what we need to talk about here at Amp Life Talk Radio. So that's going to be our topic tonight. And before I even start the show, I want to throw it out to one of our sponsors. Valley Wound Healing Center of Modesto, California is going to be our first sponsor for our beginning of the show, our pre-roll. So they do really good work there. I work with them a lot. They are the place in Central Valley, Modesto. If you have something going on, a wound or something that needs special care, they are the ones to go to. So if you're looking for a place that you need to go get yourself patched up and back on the road, Valley Wound Healing Center of Modesto. They're really good people there. Tell them you know Sean and you heard it on Amp Life Talk Radio. I want to welcome you guys to this show. Hey, there's been a lot going on. We finally got recognition from Amputee Coalition of America as an official resource for amputees. I was really proud to see that. They put us on their Facebook page and their Twitter page and gave us some really good things there. They said some really nice things, and I was really impressed with that. We're going to be working with them. So you're going to be actually hearing some of their people come on here and give information, advice. They're going to be doing some really cool things with us here at Amp Life Talk Radio, and I'm looking forward to that. I'm going to be working with them to put together some shows on their behalf on our platform. So we are kind of like one of the official, deals for them. So I'm looking forward to that as we work all those particulars out. So stay tuned for all that. I'll make sure you know what's coming up with all that. For those of you that are new, Amp Life Talk Radio, a talk show that empowers amputees with knowledge and support to make a real difference. If you're dealing with limb loss, you're not alone. I just want to let you know that you have a place here. This show is all about you, the listener, the viewer on Facebook. I do this show for you guys because this is your platform. This is your resource. I try to make it something that you can use and share with each other to help us get past the emotional issues and troubles that we have with limb loss. Advice for a new amputee. That's the title of the show. And that's what we're going to be talking about tonight. The loss of a body part is one of the most invasive interventions in the body that anyone can experience. No matter if it's an arm or leg, to be amputated, it is never easy. But it may be a bit easier if one accepts help and advice. Falling asleep, waking up, and everything in your life has changed. You wish that it was as it was before. This is the wish of many newly amputated people. But unfortunately, an amputation is an irreversible physical change. Any minor amputation of a limb means a loss of a different body part that you will never experience again. Body part of the patient, body part of the amputee, consequently, the loss of his or her integrity. The loss of a limb is equivalent to the loss of a close relative or a loved one. Many amputees describe that feeling when they lose a limb, waking up, looking down, seeing that that limb is no longer there. When people become amputees, they give you plenty of pamphlets, they give you plenty of handouts on what to expect. Most know about phantom pain and that they will need to relearn how to walk. Some even have a basic idea about what prosthetics are available to them, thanks to this day and age of the internet, YouTube, man, what else is out there? People can get a good general idea of what to expect when it comes to prosthetics. Some good, some bad. But there are numerous things the majority of new amputees have no clue about, or were even told, or never listened to because of denial. When you're in that place of hearing that news, you kind of just turn off. There is so much to take in when that happens, when you're in that place, when you're having that conversation. What advice or what would we say or what can we say to the new amputee is the topic I posted on Facebook. I got a multitude of variations of responses from that. Some of your Facebook responses, I will and I want to read them later on in the show. But it definitely showed me one thing, that this is a big topic, and that so many of you care about it, judging from the comments that I got. I want to do a show to give it some discussion, to give it some time, to put it on the table, to have us all talk about it, to have us all think about it, and to put some good information out there. That's the biggest thing I see with some of the topics there on social media. It's making sure the right information is getting out, especially to new amputees. So tonight, I want to put some good information out there for those of you who are new to Amp Life Talk Radio. So tonight, let's talk about this topic. As we move into segment one of the show, I want to give a big thanks to my main man, Rich at Soul Effective Productions. My intro is done by him, and some of the tunes that you hear that I play in between spots, they are from him. I couldn't do this without a good sound man behind me to produce some good sounds. Segment one of the show, we want to talk about reasons for amputations. This is a good topic for new amputees because reasons for amputations will determine a lot. Depending on the type of reason you got your amputation is going to determine where you're at emotionally. So that is a really and probably the most important thing to get to right off the bat as we talk about advice we would give to a new amputee. There are different causes that can lead to amputation. It is essential whether the person can prepare for this amputation over several months or a year. During an illness before the amputation, some people have reconstructive surgery that takes place over years that eventually will lead up to the doctor finally saying they're going to go to an amputation. Or whether the loss of the limb is caused by a traumatic event, such as a car accident, motorcycle accident, or work-related accident. Any amputation is devastating and definitely a life-changing experience. Its effects are far-reaching, and varied, with no two amputees or two cases being exactly the same. However, there are some overriding features that are common amongst amputees. So to assess the total effects of amputation on a person, a number of factors must be taken into account. Let's go through some of those. The type of amputation, as we discussed, that is probably one of the most important ones. Keep in mind, this is something that I do as a director of patient care and a peer visitor and peer counselor for amputees. When I'm introduced to a patient, this is pretty much what I do when I go in. I want to find out type of amputation, BK or NAK, because that's giving me information and is helping me understand how I'm going to be able to talk to this new amputee. The condition of the remaining limb, your sound side, your sound leg, the leg that is not amputated. We want to know that information. That information is also important too in helping this person, a new amputee, understand where they're going to be at, getting back to life, getting back up and moving, whether a prosthetic limb can be used or not. That happens sometimes. The person's age is very, very important. Younger people can tend to get back up and get moving better than someone who's higher up in age. But the downside to that too, as we'll see later on in the show, younger people are more devastated by an amputation as opposed to someone who's older. Their pre-injury health. What was your health like before you got an amputation? Were you dealing with health issues, or was this a traumatic type injury? And if it was a traumatic type injury, how was the rest of your body affected in the trauma besides the amputation? These are all important. Other injuries sustained at the time of the amputation, which is pretty much what we talked about, because that is so important, where people that are involved in car crashes, we typically see a lot more injuries sustained to backs, arms, and other parts of the body that will affect them and the process and the term before they can actually move into the prosthetic device. Their domestic situation. What is your situation at home? That is all also important and very important, because that's your support structure. The emotional and psychological effect on the person. How is this person dealing with this limb loss? Are they even able to look at the limb itself? Are they in denial, complete denial? Are they angry? What's going on with this person? These key points that I just pointed out right now are all crucial to the new amputee. And even for some of you out there who have been an amputee for quite some time. I actually talked with a young guy today, and some of these things right here can probably be applied to him. He's already into, I think, his second prosthesis, and some of these things probably were never discussed with him, never went over, never talked about. So we're all in different places when it comes to this. Physical effects of the amputation. The immediate physical effects of the amputation may seem very obvious. For example, the loss of a leg will prevent a person from being able to walk without some form of assistance. However, such is the dramatic change to a person's body, there are several factors or several further physical effects that can impact the life of an amputee. Mobility and dexterity. How is it going to affect you getting around? How is that going to play on you as an amputee trying to do what it is that you do on a daily basis? The main effect of lower limb amputation is a reduction of the person's mobility, to being able to get out and see friends, being able to get around the house, being able to go check your mail, all these little things, being able to get up and use the bathroom. All these things will affect the amputee, the new amputee, meaning that they will not be able to walk as they did before the surgery. That's a tough one for a lot of people. In the majority of cases, after sufficient care and rehabilitation, of course, the injured person will be able to make use of a prosthetic limb. But until then, the mobility of the person is going to be something that's going to weigh in on this person emotionally. Meanwhile, the loss of an upper extremity or an upper limb will also affect mobility, most likely affecting a person's balance. Losing a complete arm will throw you off. It will seem like you're clumsy. This can make the amputee more prone to falls or collisions with objects and people. While they will not usually require a wheelchair, their mobility and agility may be adversely affected, especially in the early stages after their surgery. Getting used to a portion of your body not being there can be sometimes cumbersome. After someone has undergone an amputation, it is likely that the basic pursuit of daily living will become much, much more difficult, or even perhaps impossible. Previously, tasks that you didn't really think about, such as food preparation, getting a cup of coffee, going to the restroom, washing dishes, doing homework, housework, may become a tremendous challenge to the new amputee. And the amputee may be limited in activities that they can perform unaided, meaning they need help with everything. Can get very frustrating. Many of these are tasks that we often take for granted, such as getting dressed, bathing, or carrying shopping bags. Upper limb amputees have lost the ones that lose their dominant hand, especially for guys who signing paperwork, signing your signature. Losing your dominant hand or your dominant arm will likely have major difficulties on you in completing tasks that require manual dexterity. And to compensate for this, the new amputee, will have to learn how to use their previously non-dominant hand. Whether you're a righty or a lefty, you're going to have to switch things up and learn how to do things the opposite way. So think of this, something as simple as a transfer using one less arm. If you're a right arm person and you're typically used to doing everything with your right arm, now you're going to have to kind of learn to do everything with your left, which means you have to switch up your entire body to do stuff. This can let frustration set in. Something so simple now has become a task that requires more effort, can become very frustrating. Now, good preparation will definitely help you in the healing process. If someone has the chance to prepare for an amputation, that's probably the best case scenario. The more preparation, the more time, the more people you get to talk with, that's going to make things a lot easier for you as you go into this process of becoming a new amputee. I highly recommend this type of preparation. Take advantage of that. But the problem is most doctors don't see the importance of this. They will do a certain amount of this, but not to the point to where it's going to really benefit the amputee. This time before the operation should be used as effectively as possible so that the healing and rehabilitation can be best used. I mean, the most optimal process possible. It is important to take into account both the physical and psychological aspects that arise with a medical intervention. That means having someone come in and speak to the amputee or the person who's about to get the amputation. It is important to be informed early by your physician about this process and the consequences of the surgery. All the questions about the surgical procedure you should want to ask your doctor and clarify with your doctor and discuss with your doctor. The treatment and the possible prosthesis should be something that comes up and talked about once your level of amputation is determined. Any uncertainties relating to business and private life should all be clarified. Most of you know my last show, I talked about intimacy and sex. Unfortunately, in this day and age and era, no one's really covering those topics for couples, even for single people who are actively dating. That's a very important topic to address with new amputees. And so, for those of you that are new amputees that are listening to the show, refer back to my other episode, and we do get into that topic. One important thing that I think is so important with new amputees is that relatives should be involved in the entire process. Family members, anyone that is going to be close to that new amputee needs to be involved in somehow, some way. They are very important and can provide you with that support that you're going to need, both morally and practically, when you come out the other end of surgery. As an additional source of information and support, other people with amputations, such as myself, a peer visitor or an amputee peer visitor or peer counselor, can come in very handy, helping the amputee understand some of the um, issues and things that he can expect. Other people with amputations are a great source of information and can be very therapeutic for the new amputee before he is a new amputee. A great place to look is at Amputee Coalition of America. Go into their website. You can get in touch with a peer counselor or a peer visitor. I should say peer visitor because they do peer visitors. I'm a little bit of both. So that's something to definitely look at if you have the opportunity. Most people probably don't even know about that as they're going through this process, and most doctors don't even know about it. So I want to put that information out there. If you or yourself or somebody out there is about to go through an amputation procedure, go onto the Amputee Coalition of America site and check it out. They have a lot of information there. They're a really good source for amputees. I myself have been with them for, almost 3-4 years, almost going on 5 as a peer visitor. So I highly recommend them. And if you're in the Central Valley area, feel free to reach out to me. You can get in touch with me on Facebook, or you can find me through my talk show, Sean Harrison, or Amp Life Talk Radio. You can actually contact my lead contact, the person that puts me in touch with all my patients or puts me in touch with people that want peer visits. She is here, and she will probably end up putting you in touch with me if you're in my area. But that is a great resource, and I can't say enough about that, especially after today. I'm going to give him a shout out. I don't know if he's listening, but Zach, man, it was great talking to you. And he was one of my peer visits today that we actually got to talk. And I think we're going to get really close, and I'm going to help him out. And it makes a huge difference when you have someone helping that is a fellow amputee with a new amputee. It is such a huge thing. And I was really proud to be able to reach out and talk with you today. And hopefully you're listening to the show and getting some information from it. But I want to give you a shout out there, big guy. Keep your head up, keep pushing forward. You're doing all the right things, and we're going to meet up and talk and help you out. Okay. Fear and anxiety and uncertainty can be reduced by the personal experiences of a fellow amputee or a person with an amputation. However, it must be very clear that the treatment process is individual And a direct comparison with other patients or other amputees is not advisable. It's not possible because we're all different. We may share some common ground, but for the most part, each one of us is going to be different in our experience and our journey. And that's one of the things that I want to put out there to each new amputee out there. This is about a journey, and all of our journeys are different. We all experience them different. And some of us along our journey experience certain things. We found ways to do certain things that work for us. All we're doing is sharing that information with the new amputee to help him somewhat kind of turn on that light switch and figure some of the things out. So keep that in mind when you're thinking about this. Not everybody is the same, and I can't say what's going to work for one guy is going to work for you. What's going to work for me may not work for you. It's very, very important to remember as you try to disseminate information to a new amputee. As we get ready to move into segment 2, we're going to take a little break and get ourselves ready for segment 2 of the show. So stay right there. Don't go anywhere, and we'll be right back. And welcome back, everybody. Amp Life Talk Radio, segment 2 of the show. And this segment is going to be brought to you by our good friends and partners over at Central Valley Specialty Hospital here in Modesto, California. Segment 2 of the show, finding the right attitude to amputation. I'm going to say that again because that's probably one of the most important things for a new amputee, finding the right attitude to amputation. What does that mean? What are we talking about? I want to say this: share the show, people. Share it, share it, share it. Um, I want everybody to hear this show tonight, especially into the amputee support groups that we go into. Please share the show over there so people can come in and listen and hear this. Finding the right attitude to amputation, that's probably the most important aspect for a new amputee is attitude. Your attitude is going to dictate a lot for you. It truly can make or break you. Emotionally, this will be the most difficult thing to prepare for. While there are things you can do to prepare for an amputation emotionally, it is impossible to know how you will react when you actually see the missing leg or the missing limb. Most amputees need to grieve the loss of this limb. It's really hard to look at it in the beginning. It's really hard to process, to look down and not see something that you have had for however long it is of your life, and now it's no longer there. Personal attitude of the new amputee towards the amputation is most important. I cannot stress how important that is and how it will lead to a positive, productive, full return to your life. The amputation should be viewed as a positive step towards improvement or a stabilization of your health if health was an issue. Sometimes people are getting an amputation because it is a life or death procedure. Others, it's a trauma. Others, it's pain. But how we view that in a positive way can either move us forward or move us backwards. Our positive attitude is going to be the key to unlock the door to living. The recovery and rehabilitation can only be as successful as the patient's attitude. It can only be successful if the patient is actively involved in the entire process. Your attitude will affect this process. I have been called in numerous times to speak with patients who want nothing to do with the physical therapy staff at hospitals that I go into. They call me because they have a patient who basically is telling them to get out of their room. They don't want to talk to them. They don't want to participate in physical therapy at all. There are so many reasons why this is crucial and important, and a very important stage right after surgery. It sets you up to move down the path to getting your prosthesis. Most amputees don't even know that. Physical therapy notes are taken all along this process and are passed along with you in your medical charts. These are things that you need to take into consideration because your insurance company will take this into consideration when trying to get you covered or cleared for a prosthetic device. Your attitude is going to be something that, like I said, it's going to be the key that's going to unlock the door for you to be able to get back up and get back at life. If there is no preparation during this phase to work on the attitude, if possible, that is probably the best thing, is to help someone prepare for the aftermath of an amputation. It's hard to keep a good attitude. It's hard to stay positive. But if we can, if there is some way to prepare for this, we should. If there is no preparation during this phase, or if it is not possible to do so, I highly advise to immediately talk to another person, an amputee peer visitor who has been affected, as early as possible, as soon as you can, as soon as you get your mind right and you can get back to a point to where you're ready to deal with things. That would be the most important thing I can advise you to do. It will help your attitude and motivation tremendously. I am currently trying to teach the doctors in my area, Central Valley, this. It is so hard to break the old school mentality thinking in the Central Valley. Some doctors have embraced it, and I'm working very well with those doctors, and they see the positive feedback from their patients, the patients that are up and ambulating and moving on with their life. And then there's the doctors who are continually giving patients to people who don't believe in this and don't practice this. Their success rate with their patients getting back up and being successful back into life, integrating back into life, not so good. I cannot express that enough. I want to reach to every doctor out here to help them understand the importance of helping someone come in early to help the patient establish their attitude, because that is going to be probably one of the most important ingredients in overcoming all the things that you're going to face as a new amputee. This can give a positive perspective on the life of the new amputee, meeting with another amputee, a peer visitor. This is important for the psychological and psychiatric support of a good certified peer visitor that can do wonders to inspire the new amputee, give them confidence. And the biggest thing about that, to inspire, give them security, confidence, but without giving them unrealistic hopes. That is so important for new amputees when you find yourself moving into that phase where we're about to get the prosthetic limb, or even talking about prosthetics. You want to be with someone that's going to be They're to instill into you what's right. We don't want to sell you false dreams or false hopes, because then that can be a major setback with a new amputee. Giving someone or arousing unrealistic hopes in a new amputee can cause major damage and cause the amputee to actually go backwards instead of forwards. It is completely natural and normal to have good days and bad days. I think that's something that you'll learn from talking with another amputee. You're going to learn it from listening to this show. I have good days, I have bad days. I know everybody that sees me and meets me, they think, man, he's so positive. You're so this, but I have my good days and my bad days. I have days when, I have things going on. I go to the gym, work out, I get a blister on my leg, and I'm like, oh, man, that sucks. I mean, now I got to do all this stuff. So we all are going to have good days and bad days. There's going to be days when you're in pain, whether it's the heat or the cold. We're all going to experience it. Every amputee goes through it. My best advice, again, is attitude is everything. It is very important to have a positive attitude about the amputation, and that it's going to improve your life, not end it. I want to say that again. It is good, it is important to have that positive attitude, because attitude is everything. It is most important to have a positive attitude about the amputation, that it is a good thing to improve your life, not to end it. It was my positive attitude that got me through, and the reason I didn't fall apart emotionally. Keeping a positive attitude. When they told me that, I wanted to amputate my foot, I looked at it from the perspective of, it's just a shoe. It's just a shoe. It's just a foot. I'll be fine. I'm going to get up. I'm going to walk again. I didn't let it overwhelm me. There were moments when seeing my foot gone, yes, it sucked and it was a lot to take in. But I kept going back to that. I'm going to do this, man. I'm going to get a foot on and I'm going to walk. So keep that positive attitude, because it is everything. While we're doing this, part of the attitude, there's a process of preparing your family. If you have kids, the subject of your amputation needs to be a common conversation in your home. Do not take the amputation, or do not make the amputation a family secret. It's something that you should embrace. Your children, your wife, your spouse, your girlfriend, your mom, your dad, your grandma, uncles, aunts, they should all know about this. And it's like I said to the young man I talked to today, you're not an amputee, you're an ambassador. You're an ambassador because you're going to educate all these people about amputations and what it is to be an amputee. So don't look at yourself as an amputee. Look at yourself as an ambassador. You're going to go out and you're going to teach people what it's all about to be an amputee. You want to get that out on the table and discuss it, make it part of your daily family life. That way, no one in the home looks at it any different. Keep an open communication. Keep those lines of communication open about the amputation, especially with your spouse or your partner. They will be your caregiver and caretaker in the first few weeks, and this will forever change their lives as well. You need to help them prepare for not only your needs, but their needs as well. It is impossible to know how any amputee will react after surgery. Even if you go into the surgery feeling prepared, I'm good, I can handle this, I'm okay, it's after the surgery. How you're going to handle the aftermath. You could fall apart when you see your stump for the first time. I was very fortunate that I had the strength to handle the whole process with a positive attitude. Seeing my stump was devastating. I'm going to be honest, I cried. I remember the feeling of loss, grief, shock. I remember telling myself, you're going to be okay. It's just a foot. You got to keep it together and do this. The best advice I can give is attitude is everything. Get in the right mindset and be determined to maintain a positive attitude about the process. Learn to take this in stages. Do not bite this off in one big mouthful. Taking this in stages helps you digest it properly, helps you digest it in amounts that you can handle. Preparing for the stages until the end of this journey, you need to take little bites. Preparing for the stages along this journey, you need to take little bites. This journey, which will be your lifelong experience, my friends, new amputees, pace yourself. Amputation will forever change your life. So the challenge is for your life not to take it all at once, but to take it in small amounts. And with the correct attitude, some hard work and determination, your life will be productive and rewarding. If you need to be done, and I could find, well, we'll say, if you need things to be done, there's always going to be a way to find to do them. You're going to learn to adapt. Things that need to be done when no one's around, when you're sitting there and you're like, man, I need to get this or I need to do that. You got nobody to help you. You're going to find ways to adapt to different things, ways to complete tasks that you never thought you could do. But keeping a positive attitude towards it is going to make that process easier. And I found that keeping a positive attitude helped me. I even amazed myself many times in what I was able to do and accomplish with one leg. With this type of mindset, I didn't sit around and wait for the prosthetic leg to resume my life. I made the most of my crutches. I tried to get out and do as much as possible as I could. With the help of a friend, I was able to go out and do things. Keep in mind, you need to be safe at all times because you are hopping around and you're a trip hazard. I fully engaged back into a full productive life well before I even started to begin the prosthesis process. Mine took almost a year before I got my first prosthesis. I had to fight for it. Keep in mind, there are no limits of what you can do. But I also want you to keep in mind, if you are out there and you're using crutches, you need to be very careful because you will fall. And they tell you you're going to need to learn how to fall. Well, that's a tough thing to teach over the radio. But there are ways to fall so that you don't hurt yourself. And as I mentioned before, you're going to use crutches. Crutches will end up being your best friend for an extended amount of time. If you are not experienced with using crutches, my suggestion is to get a pair and to learn to use them. It's kind of hard when you already have lost a foot. My advice is to get Canadian crutches. I call them arm crutches. They wrap around your arm. These will be a valuable tool that you will use even after you get your prosthetic leg. There will be times when you don't want to put your leg on because it's sore. There'll be times when it's just more convenient to grab your crutches and go to the bathroom. Get a good pair of crutches. That is my best advice that I can give you. Your ability to use a pair of crutches will make your recovery much, much more easier. Not only will they provide you the most efficient way to get around the house without your prosthetic leg, they will also aid you in your overall health. Anyone that has used a pair of crutches understands your arm strength is going to get really good. Plan a simple routine with your crutches of walking, using them throughout the day. You don't want to just be sitting in your house 24/7 on the couch, eating ho-hos and, you know, cream puffs and stuff like. You don't want to do that. You want to get up and try and move, because sitting around 24/7 just waiting on your prosthetic leg to be given to you is probably not the most healthy thing to do. It's also going to help you prepare yourself for getting back up and getting moving. The best way I found to relieve some of the boredom and some of the issues that you're going to experience is to just get up, get outside, go for a walk. You can go for a walk with your crutches. Do things. Make yourself get up, make yourself get out, get the sun on your face. You'll feel so much better. You also want to get up because it will improve your blood flow. You're also going to want to get up because it's going to help you do things for your leg that you need to do. Stretch it out, move it around. All these things are going to help with what we all know as phantom pain. Getting that leg up and getting moving, stretching, rubbing it, elevating it, getting out and moving is probably going to be one of the best things you can do while you're in that process of waiting for your prosthesis to be made. Be safe and don't go out and do crazy things, but you want to get up and try and do certain things with the crutches that you have. That is probably one of the most important things you will come to see that will probably help with your sanity level as you're sitting around waiting for a prosthetic device to be made for you. As we get ready for segment 3 of the show, I want to give a nice shout out to one of our other sponsors, and that's my company, Synergy Prosthetics. We have locations in SoCal, the Bay Area, and Sacramento. If you live out here in the Central Valley area or Sacramento or East Bay area, check us out. You can go online and look at us, Synergy Prosthetics. Look at us, check us out. We are a mobile prosthetic company. Read about that and find out what that's all about. It's pretty cool what we do here at my company to help amputees get their life back. Going to take a quick break and we're going to be right back.
Sean Harrison.
So as we get into segment 3 of the show, the before and after. What does that mean, the before and after? Well, patients feel often anxious before an amputation surgery, especially if you've been told that and you're waiting to do it. Your nerves are all over the place. Your emotions are all over the place. You're a nervous wreck, man. Also, one of the things that can kind of happen to you before this is sometimes you can become very depressed. And these are things that we need to watch out for. And you need to talk. Communication, remember, talk to your spouse, talk to your partner, talk to your family members, talk to your doctor. This is your team that's going to help you get back to living. If you're having some of these issues in this phase, the before and after, you need to talk with people. Having trust in your doctor and your treatment team is probably a very valuable thing to have. I hope that you would trust your doctor before he amputates your leg. So it will definitely help put you at ease on some of the things that you're going to be feeling. Now, after the surgery, the pains and questions about the new life are immediate. First, there will be the pain. Trust me, the pain. Dealing with can be tough, but it will pass. I want to make sure that's out there. You're going to experience a lot of pain after your surgery. They're going to give you meds, but they're going to take them from you. But you will get through that. Most of it is just the actual pain from the surgery, the procedure itself. For many new amputees, the imagination is a lot worse than the reality of it. And they quickly learn to cope with the new situation. Other people need a little bit more help and a little bit more time. For example, like we said before, I think one of the biggest issues with people is that they can't look down at their stump. So at the beginning, this is really hard. There is no time frame on this or no set parameters when you need to do it. It's just something that takes time. But it is a very important part of you regaining your life back. With patience and affection, the new amputee can usually accept his condition pretty soon. It is important that your relatives, your family members can all accept the patient as a full person. This transfers the new amputee, it transfers to him and helps to build self-esteem. How people accept you after you come out of the surgery, how people view you, how they see you. You're already going to have those issues and thoughts in your head. So we need to make sure that our family and people that are close to us that are going to be around us immediately after surgery are looking at us as a full person, not as a damaged person or part person or half person. This is going to help the new amputee build self-esteem and confidence. It's going to work on their body image. The time between surgery and their prosthetic adjustment, or we'll say prosthetic fitting. Most amputees, this process between surgery and being casted or being seen for your prosthesis is particularly time sensitive. It can take time. It's going to be tedious. There's processes that need to be taken care of. It's not just boom, we come in, slap a prosthetic on you and you're out the door and you're running on your way. You need to be healed. You need to be in a shrinker. There's insurance authorizations. There's castings. There's fittings. There's test sockets. It takes a lot of time. It can be very exhausting. So some face a variety of changes after the amputation, which can lead to your residual limb changing quite frequently or changing in size, shape, sensitivity issues. So be very patient during this time. In addition to the physical functions and limitations you're going to be experiencing, we need to look at one other thing that is pretty important, and that is psychosocial issues. In this field, this term, psychosocial issues or psychosocial phase, plays a very crucial role. Often changes in one's profession or family environment. This is something that happens after amputation. And all of this has to be processed by the amputee. This phase or this term, it's something that we all go through as new amputees. In this phase, many specialists are trying to work with you to ensure the most possible best scenario for you to come out mobility wise, to help you not go through some of the issues that you're going to be experiencing in such a bad way. It's going to limit physical activities, the psychological rehabilitation and social situations from this are going to play essential roles with the new amputee. Rehabilitation after the amputation is fundamentally dependent on that patient's psychological adjustment to the injury. Practitioners need to understand, physical therapists need to understand the sensitivity to the psychosocial issues that this individual will be going through. They need to have a clear, practical implication for both, for the successful prosthetic fitting and outcome of the patient. So crucial for the patient to be successful in his rehabilitation, to address these issues, to pay attention to these issues. The rehabilitation after an amputation is fundamentally linked with the individual's psychological adjustment to the injury. Typically, the most immediate challenge facing an individual after an amputation is what? Acquiring a prosthesis and becoming proficient in its use. Most people want to get back up and get to life and get a prosthetic device and start using it. From a psychological perspective, rehabilitation begins as soon as the amputation is considered. Most don't get this, but this is probably the most appropriate type of intervention for a new amputee, to start this before the amputation or as soon as the amputation is considered. Having early contact with a peer visitor and a peer counselor, such as myself or rehabilitation personnel, can be very beneficial to providing counseling, information, and advice and in the facilitating the development of realistic rehabilitation goals. We kind of touched on that earlier, but I think that's a really important aspect too. When you start this process early with the professionals, they're going to help facilitate and get you ready for realistic rehabilitation goals and expectations. You're going to learn a lot going through this. You're going to learn what's appropriate and what's right. As I mentioned, a lot of people learn stuff from YouTube and the internet. 9 times out of 10, it's wrong because it's not appropriate for you. I had a patient who was an older gentleman looking at YouTube and seeing these guys that were 25 and 26 with above the knee amputations doing all this extreme stuff. And he thought he was going to just pop on an above the knee prosthesis at 80 and go out and play softball. It's not going to happen. So we want to make sure before the amputation, we want to make sure that you're getting correct information and we're giving you real goals, real expectations of what to expect. I do this on a daily basis with the doctors I closely work with in my job. And it's probably one of the number one questions that we get is, when am I going to get up? When am I going to be able to do this? Well, we have to tell them that's going to take some time, man. And you're going to need some therapy. And me as an amputee myself, people see me and they immediately think, well, I want to do what you're doing. I mean, because I do Spartan races and I'm doing all these things, I want to do what you're doing. Well, we're different. And that's part of the new amputee. Giving a new amputee advice is also being realistic and letting them know the truth about where they're at, what to expect. Readjusting to life after amputation is likely to be challenging for most people. It was challenging for me. It took me 3 months to get back up to where I could walk with nothing, no crutches. Difficulties in the adjustment are typically associated with depression, people feeling down, getting control of their self-esteem, people feeling hopeless, fatigue, anxiety, suicidal tendencies. There are a multitude of related problems, including coping behaviors, those that may have introduced drugs or alcohol along the way. All these things are going to play a role in the new amputee's ability to get back to living life. Amputees undergoing amputation as a result of a traumatic injury, especially in a motor vehicle accident, may also experience post-traumatic stress disorder, PTSD. This changes everything for a new amputee because you have your amputation that you're dealing with, and now you've got this also put on your plate. Getting past this can be hard, especially if we don't know what we're dealing with. And a lot of times people don't know why they're feeling what they're feeling. The majority of amputees experience stump pain and phantom pains. Shortly after their surgery, you hear or see them grabbing their leg, winching in pain. Well, what are these for the new amputee? He's probably thinking to himself, what is this going on? Why am I feeling this? Well, stump pains are caused by processes that are localized in the stump itself. Phantom pains can occur after the removal of a limb, which denervation can take place. That is the loss of nerve supply. Your nerves have been severed in that limb to that foot. So your nerves now, the pain pathways that go through them, they have nowhere to go. This is what causes a lot of the phantom pains. They may take on different pain characteristics and are triggered by various factors. Heat, stress, all types of things can fire these things off. Phantom sensations are sensations in the area of the limb that is no longer with us. Your foot may itch, you may feel your toes wiggle. All these things to the new amputee are just so out there because they're looking down, but yet their foot is doing something. Who do you tell that? Who do you tell, hey, man, my foot's itching? You don't know who to tell that. You don't even know how to process that. These are all normal things that we've all had to go through. A good preoperative and postoperative pain management is very important. Today, they definitely have some wonderful drugs out there to help combat phantom pains. But the truth of the matter is, there is no cure for phantom pains. Post-amputation pain in the phantom limb, often described as burning, cramping, and shocking, shooting types of sensations, can be extremely distressing to the amputee. There is no definitive treatment. I know you don't want to hear that, but there really is no definitive treatment. Limited success includes, medication, neurological uh, processes, neurosurgery procedures, all these things. Nothing has been definitive in curing this. I want to put out there is no formula for coping with an amputation. Each person affected by an amputation overcomes that process of being an amputee differently. Personality factors, social environment, age, health, fitness level, and previous life events are of great importance in processing an amputation. We've kind of talked about that earlier. Probably one of the biggest topics that we're going to get into or that you're going to face as a new amputee is body image. Body image is very crucial and probably one of the most devastating things that new amputees go through. We're going to talk about that here in segment 4. But before we do that, I need to wet my whistle because my mouth is getting dry, and we will be right back.
Hi, this is Charles Burleson. You are listening to Amp Life Talk Radio.
Well, guys, segment 4. One of the most important issues that you're going to face as a new amputee is body image. What does that mean? Think about that for a second. I think I've thrown that out there to you guys a couple of times about looking in a mirror. What does body image mean to you? How do you see yourself? You're a new amputee. Body image, process that. Well, boys and girls, body image is a picture or scheme that we have of our own body, how we see ourselves. We form it in our minds. We have this, constructed picture of us. Once amputation happens, that picture changes. And even before amputation happens, our body image is always constantly being reconstructed, deconstructed in responses to both internal and external stimuli. The body image establishes distinctions by which the body is usually understood. Who we or how we see ourselves, how we feel others see us. It's very important to a new amputee. The experience of amputation promotes a disruption of one's body image of themselves. And that can affect us. It can affect us in varying degrees when we think about our body image has been alterated. There's an alteration that has happened. Reconceptualizing of body image after amputation requires the incorporation and acceptance of both the loss of the limb as well as phantom pain sensation of the limb. And in some instances, the incorporation of a prosthetic device, cane, crutches, or walkers. The new life as an amputee affecting how we see ourselves, our embodiment and sense of self. How are we dealing with that? This is a huge factor for new amputees. Doing so helps the new amputee relate to a concept of embodiment, how we view ourselves, this body image, how we conceptualize our body after the amputation. It requires us to accept both the loss of the limb as well as all these other things that are going on. Doing this as a new amputee is going to help you understand your embodiment. What does that mean? The concept of embodiment. Well, a concept in which an amputee experiences him or herself and they construct a meaning out of their experiences with influences their attitude towards the wearing of their prosthetic device, how you are taking on this new form, wearing your prosthetic device. This is different for each amputee. A given prosthesis may embody ability for one amputee because they feel it enables them to perform certain functions or physical functions and social roles, whereas the same prosthesis could be a disabling embodiment for the other person because they view it as a prohibiting those roles and functions. It prohibits them from doing things. It's a prohibitor instead of a inhibitor. Experiences of one's own body are the basics for all other life experiences. Body image and embodiment and the sense of self are something that's very important to new amputees. And hopefully you understand that concept, how we view ourselves, how others view ourselves with and without the prosthesis. We keep talking about age. There are some implications as far as age when it is concerning new amputees. The age at which one receives an amputation is is so important and such an important factor in the adjustment of a new amputee. For a young person who was hurt in a traumatic accident, they're going to experience things different than an older person who suffered an amputation due to a disease related cause. Limb loss and the accompanying loss of function may represent the loss of life, loss of opportunities. For a young person, dating, jobs, traveling, whereas an elderly person with peripheral vascular disease or disorder, the amputation may offer increased mobility and sometimes an ease of physical distress. Studies have shown the results, but the research is still very, very limited. This research is new, it's limited. There's not a lot out there, but I can tell you this is pretty much spot on. Young people are going to view amputation completely different than older people. Let's talk about something that needs to be talked about for new amputees: the bathroom. The bathroom is like a Spartan race for the new amputee. It's full of obstacles. The bathroom was one of the areas in the house that I found to be the most difficult to deal with. Going in, taking a hot shower, coming out, linoleum floors, they're slick as ice, man, and you've got crutches. How do you get out of the shower without killing yourself? So, the bathroom, it's where just about every new amputee patient falls and has an issue with their residual limb. The bathroom, it can be devastating and very dangerous to new amputees. The bathroom, I want to keep saying it because I want to make it stick in your head. Be very careful in the bathroom. Make sure you have your shower set up. You have an overall general plan on how you're going to get in and out of the shower, maintaining balance on one leg. Have grab bars, whatever you can get in there, a bench to sit on, install hooks on the shower. The bathroom is treacherous terrain for a new amputee. So be careful, my friends, in the bathroom as a new amputee. It's even harder once you get your prosthetic device because you're going to find a sense of, okay, I got this. You can still slip and fall. So just keep that in mind. I recommend putting in anything and everything that you can put in there, from bars to grab. They have the ones with suction cups on them so you don't have to drill holes. Any type of rugs or mats that will stick to the floor that won't take off when you step on it. Anything that can suck up water. These are all so important. Having a game plan before you go to the bathroom can make a big difference between a revision surgery and moving forward with your prosthetic device. I just want to put that out there. As a new amputee, I hear a lot of people talk about how they are scared of infections. There's always going to be problems with some type of infection because you just had your leg amputated, and that is an open source for infection to get into. So if you find yourself going back in and a doctor wants to put you on a treatment of antibiotics, don't freak out. Don't think it's something bad. It happens. It happens with just about every patient out there. One of the biggest things I want you to be concerned with is muscle contracture. If you got a wheelchair and it's taking you some time to get into your prosthetic device, work on keeping that leg straight and keeping it out so that you don't get any type of contracture in your hip or your knee area, depending on if you're above the knee or below the knee amputee. Probably one of the biggest things you're going to notice is fatigue. you're going to be very tired very quickly while doing normal things that you typically probably didn't get tired doing. It's because you have one less limb doing something. Things may take a little bit longer, which means you're up more, which means you're going to tire out more. You're going to expand and use more energy using a prosthetic device. So that's natural. So fatigue can become an issue. As we wrap up the show, I want to talk about some of the emotional effects of an amputation. The psychological and emotional effects of losing a limb can be very, very extreme on individuals, and they are very significant. So please, please just take this in. There's the traumatic effects. If a person has experienced a traumatic amputation, we want to keep an eye out for PTSD. That is something that is a very important issue. They may not know what they're going through, but you should be able to pick up on it just by knowing some of the symptoms: flashbacks, nightmares, depression, insomnia, avoidance, anger outbursts, and various other challenges in their behavior. Keep an eye out for this kind of stuff for your new amputee so that we can get them the proper help. Adapting to amputation. This is going to present something to each and every new amputee. While some psychological symptoms are the result of the initial traumatic injury or injury suffered, other symptoms can develop gradually as the amputee goes through life, living their life with a disability. It can be mentally challenging for a person to adapt to the loss of sensation in their limbs, especially upper extremities. Alternatively, it could be just a psychologically demanding person who expects a lot and now he can't do a lot. A person may suffer from aches and pains. Phantom pain has come back to haunt people as they go through life as an amputee. It can affect them because they can't sleep. Phantom pains tend to be worse at night. That's a little thing that most new amputees don't know. I think the biggest thing we're looking for is depression. It is a very common symptom among new amputees. Keep an eye out for these things and try to protect our loved ones that have become new amputees, because they are definitely treading on new territory as a new amputee. And we want to try and protect them and make sure that they're not experiencing some of the things that they're going to be going through. And we want to make sure that these new amputees are getting the help that they need, and we're getting them where they need to be at, in the right places, in front of the right people. I was going to get to some of your comments from the other show, but I think we are well into our show. I took up way too much time talking about some of the other things. What I will do is I'm going to respond to some of your comments over there on Facebook in the actual post. So I'll just go over there and I'll just kind of respond to some of those instead of airing those out on the radio. Hey, thanks guys for all the love I'm seeing over here. I hope you share the show, and I hope you spread this, and I hope this helped a little bit with advice that we want to give new amputees. It's such a broad topic. I tried to go through some of the most important things that I see, and I think that we need to realize that our loved ones who are new amputees are going to experience. There will probably be a part 2 to this show, just so you know. And we're going to be talking about all these wonderful issues and topics here on Amp Life Talk Radio. I want to thank all of you guys for tuning in, being a part of the show. I cannot thank you enough for all the things that you guys do for me here, helping me make this show more available to other amputees and spreading the word about the show. Hey, if you are listening and you're on the podcast, just know that we have our own app. You can get it on Google Play Store. You can also check us out on iTunes just by typing in Amp Life Talk Radio. iHeartRadio, we're still working out some technical difficulties with them. They only show half of our shows over there, but I'm going to get that worked out and we'll get all the episodes up. Over here on Facebook Live, you can also see the live video of me doing each and every show. If you want to take in all this manly stuff that you're going to get to see on a live show. A lot of people like it, so I try to keep it up. Everybody that's listening out there in podcast land, keep in mind, this is a live show. We do not do pre-recorded shows. We don't go back and edit stuff. It is what it is, and it is what you hear. So if you hear me drinking from a drinks or coughing or sneezing or sniffling, I don't go back and edit that stuff. There's a purpose and a rhyme and a reason for that, because as we take this show eventually one day to where it's going to be more than one day a week, all the shows will be live, and we're going to have it to where people can call in. So I want to encourage you guys to share the show, win a coffee mug. I want to encourage you guys to check us out and like us. Leave me comments. Please leave me comments on the Facebook Amp Life Talk Radio page. And if you want to go check out the podcast or our website, it's amplifetalkradio.com. I'm going to be trying to provide a lot of cool things out there for you guys. And please share the show, and please stay safe. And I cannot thank you enough for being a part of this talk show. Everyone, have a wonderful night. Thank you for listening to Amp Life Talk Radio.
You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.
Okay, everybody in Facebook land, we're done with that episode. Man, awesome show. I hope you guys like it, and I hope everybody found something interesting from the show to, share out there. It's a very broad topic that we could go on and on with for new amputees. Hey, I want to put this out here on Facebook. I'm putting together an event. It's called a community health and wellness fair event. It's going to be at Modesto Junior College, the West Campus off, Carpenter and Blue Gum. That's going to be on July 14th. It's going to go from 10 a.m. to 4 p.m. If you want to be involved with that, reach out to me on Facebook. If you know somebody that wants to be involved with that, we're trying to keep it free. Keep in mind, it's free. You're going to have to bring your own tables, your chairs, your little sun covers. But we're putting it together and organizing all the people that I work with in this industry to come out and do something for the community, helping people understand how to take care of themselves and better take care of themselves so that they don't lose limbs and toes and all those things. There's going to be some wonderful people out there providing information and resources. So please do spread the word for me. You can see all the posters and ads on my page. Spread those. Send them out, tell everybody about it. I want to see all of you guys there. You're going to see myself. I have Dave, the one-legged Spartan. I'll have my practitioner there, Matt, to be answering questions. We're going to do a walking clinic, a sports clinic. You're going to learn how to kick soccer balls and all kinds of stuff. Hopefully we'll have some props out there and show you some of the things that we do when we do Spartan races. So thanks, everybody. I appreciate all of you tuning in on Facebook and helping make this show what it is. Help me get our views up there back at that 2.9K. Try and get us up at that 3,000 mark. Man, that would be something to do. And I don't know if you guys see, but I have another medal here. It's out of the picture, but there it is. That's from Monterey. That's my other Spartan that I just did. Man, I'm telling you, I'm sore. Hey, guys. Thanks so much. I appreciate the love, and I appreciate each and every one of you and all the support groups that I'm on the pages. I like your questions. Feel free to send me any question. It may take me some time, but I'll get back to you. I appreciate your support, and thanks for listening to Amp Life Talk Radio. You guys have a wonderful night.